How do you feel when you're playing the euphonium?
I feel normal. But yeah.
Anxiety disappears, doesn't it?
Yeah.
And you're just
A normal teenager.
Hey Lewis, hey Sharon. Thanks so much for coming up to hospital today to talk about how your heart operation went. From my point of view in the music therapy team, we're so proud of you that you managed to get through the operation. I know it was really difficult for you, and kind of coming into the hospital even for our meetings was caused you some anxiety. So just to say thank you for making the effort to come in one last time. It was amazing to see the transformation that the euphonium gave to you. It kind of brought you alive, and I think that when we played together in those kind of sessions coming up to the operation, we were really able to think about how you were feeling about your anxiety and how we could use music to help you to get to that kind of end game of getting into that preoperative room. I don't know if you remember anything about the day of the operation that you'd like to share?
No.
You'd had quite a lot of medication. I think that's really important for us to think about, because when we're in a kind of fight-flight mode, which is what you were, your cortisol level was really high, and because you were so anxious, it was the amount of medication that you had to take was significant, and you were still able to play. We were still playing duets. I mean, is there anything you'd like to share about that?
I was just flabbergasted when I come in and he was playing Grandfather's Clock.
And not just playing it,
No.
just absolutely amazing.
Yes, and it was just like, the amount of medication he'd had.
Yeah, he should have been lying out flat.
He shouldn't have been. Never.
Incredible playing too, it was really good.
Definitely.
So is there anything that you'd like to share with us about music therapy?
Thank you very much for everything you've done, because I think by coming every other week helped him to come into the hospital environment.
Yeah.
So when we came in on the night before, he wasn't as stressed as he had been in previous times.
And me and Mel were there in the morning.
Yeah, and then when you came in the morning and you were playing, he was a different person, because obviously he was playing the euphonium.
Yeah.
And it took a little while to get him to take the first lot of medication.
Yeah. But we got there,
didn't we? Because he was more engrossed in the music then, and that was taking over all the anxiety.
And I think we did a couple of things, didn't we? We did some playing, we did some duets, and we did some playing with on Spotify. You chose one and I chose one, didn't we?
I can't remember.
You can't remember any of that?
Definitely did help.
Yeah.
Yeah, definitely. And I don't think we would have got there if it hadn't been,
And I think it was also important for us as a team here at the hospital to kind of have me working with you, Lewis, and then Dr. Nell working with you, and then working together as a kind of collaborative approach really helps, so that Dr. Nell was able to speak to you about how to help Lewis with his anxiety, and then we were able to do that too.
Like we've been coming to see her, previously.
Yeah.
The times that we were coming, he was still very anxious and frightened. And when we sort of approached the hospital, you could see a difference in him.
Yeah.
But when he started bringing the euphonium to do music with you, that was a lot easier.
I think it's worth noting here that you've been playing brass instruments since you were 2, is that right?
2.5.
2.5. Yeah. So it's a really important part of your life, and it seems to make so much obvious sense to have that as part of your kind of treatment pathway, to be able to use that as well.
Definitely. Yes, definitely. And he's a different person now as well.
I'm so proud of you, all of the stuff that you've been able to achieve since you've had the operation. It's like It's like a brand new,
This time last year, we never
swanky,
thought-
shiny Lewis.
Yeah, you never thought we would be here, did we?
No.
This time last year, so.
Well, thank you very much for coming in today. I think we should do some playing.
Yes.
What do you think? Okay. There we are then.